across the country to give us updates in what is happening in their immediate environment. We'll be getting an update from our reporter Elphas Lagat on life after the Solai tragedy that has claimed more than 40 lives so far. We understand another body of a child was recovered earlier on in the day. Elphas Lagat will be giving us those details. We'll be getting a reaction from farmers who've now reaped from the 5 billion shillings that the government is paying them. A cry they have had for quite a while now. Our reporter Elvis Koskei will be giving us that update, as well as speaking to the chairperson of the Kenya Farmers Association and just see how the situation is in the county of Uasin Gishu. Well, this and more here on KTN News Desk. My name is Akisa Wandera. Once again, thank you very much for joining us. It is now official that from the 1st of June this year, you may land in a Cuban doctor's hand when seeking medical help across Kenya's 47 counties. This follows the signing of a memorandum of understanding between the Ministry of Health and the Council of Governors this morning. The deal will see 100 Cuban doctor specialists work in Kenya on a 2-year contract. Meanwhile, an exchange program for Kenya doctors is also in the offing. Beginning September this year, 50 Kenyan doctors will be flown to Cuba for a 2-year period in which they will be trained on different specialties.
Training of 1,000 nurses and clinical officers in higher diploma course in family medicine. The training in family medicine will enhance our primary care services, an area of great importance on our journey to UHC. The importance of this, whereas the driver is going to be the KMTC, we'll also be looking to work with the private sector, and we'll also be coming back to engage and give feedback on this progress, the progress of this intervention as it unfolds. Number 3, we are also pursuing collaboration in research in areas of HIV vaccine development and hepatitis vaccines. These are also still under exploration, and we are eager to learn from the successes made in Cuba in these areas. Finally, and of high priority, which is our reason for being here today, is the exchange program for medical specialists. 3 weeks ago, I followed up the visit of His Excellency the President, and I was joined by Governor Kuti to Cuba, where we actualized 2 agreements with the Ministry of Public Health in Cuba. These agreements that have given life to our meeting here today give ground to the acquisition of the 100 Cuban medical specialists, but also gives us an opportunity to be able to train 50 Kenya medical doctors in Cuba, specifically on family health. I wish to confirm that getting the 100 Cuban specialists is a process that has undergone rigorous pre-selection and peer review by the medical practitioners and dentists board, who are represented here today and whom I wish to thank most heartily. The board has vetted and found qualified doctors, 100 of them, who will be able to speak English and are therefore able to serve our local population. Cuban doctors shall be deployed, as Governor Kuti has already indicated, to all the counties for a period of 2 years. Let me reiterate that the specialists are expected to build the capacity of our local teams through knowledge transfer and mentorship. On the other hand, the 50 medical officers who will be going to Cuba and who we are on target to move in September will undergo a 2-year postgraduate training. Again, emphasizing on family medicine, they will return home as family specialists, again change agents as we seek to reorient our medical or health system. I am therefore delighted this morning to witness the next step of the Kenya-Cuba Technical Exchange cooperation come to fruition. Honorable Vice Chairperson, I wish to thank most sincerely the Council of Governors, the Health Committee, the Intergovernmental Forum for their tireless efforts that have ensured that we are here today without having put in a lot of sweat, but with a lot of respect, a lot of engagement, a lot of commitment. I wish to especially thank the Council of Governors, Health Team and the Secretariat, which has facilitated smooth and efficient flow of information from the Ministry of Health to the counties and vice versa. The occasion is a demonstration of strong intergovernmental relations in addressing issues in health and other national developmental priorities. The journey towards universal healthcare is a long-term undertaking and requires regular consultation and coordination between two levels of government and all actors, sectors relevant to social determinants of health, such as water, environment and sanitation, agriculture, education, as well as development partners and the private sector. The Council of Governors was first informed about specialist doctors from Cuba, whom His Excellency the President had procured to support the 47 counties during our extraordinary general meeting on 3rd April 2018. The Cabinet Secretary for Health informed governors that the doctors would arrive in the country in May, that the national government would cater for their remuneration and allowances, and that the counties needed to prepare for them by providing the following: furnished housing, transport, and security. The Cabinet Secretary also mentioned that there would be a memorandum of understanding between the Ministry of Health and each county government to govern the operations of the doctors who would be deployed in all counties. Today we are here because the COG Health Committee took up this matter and has, in consultation with MOH, processed this matter to a reasonable conclusion. We are here to sign the MOU in readiness to start working with the doctors who are expected to arrive in the country on 28th May 2018. I am informed that the process of sharing the medical specialists from Cuba was a very consultative and inclusive one, with every county receiving the expert they needed the most. We wish to make one observation, that if we can do this consultative sharing for the 100 doctors from Cuba, we can do the same amicable discussions to share the local medical specialists and make sure that all counties are covered. We would suggest that this consultation by the two levels of government in sharing specialists become a regular feature of our discourse, as it will help in bridging the gap of the distribution of health workers across the country.
Well, so both the national government and the county government seem very enthusiastic and positive about this move to bring in 100 Cuban doctors, specialists especially, into the country. But in a hard-hitting statement signed by Secretary General of KMPDU, the union is not a happy lot with that particular move from the government, both the national government and the county governments. From what we've just seen, a representation from the Health Cabinet Secretary, Cecily Kariuki, as well as the Vice Chairperson of the Council of Governors, Anwai Guru, in their official signing of that memorandum of understanding to see Cuban doctors work in the country for 2 years. Let's take a look at that statement and just see what are some of the reasons why the Kenya Medical Pharmacists and Dentists Union is unhappy with this particular move and the exchange program that will also see 50 Kenyan doctors be sent to Cuba in September in that particular exchange program. So we just went through some of the reasons that were given. It was a 11-point reasoning from the KMPDU, a statement signed by Dr. Ouma Oluga, who is the Secretary General of the union. He says that across-country doctors' engagement must be very transparent before we get into anything else. The KMPDU also says that Cuban doctor importation was done in a rush. No time was taken to just take a look at all the parameters that will affect this particular move by the Kenyan government, both for the 100 doctors who are sent into the country to the 50 who will be sent to Cuba. KMPDU also says that there are 2,000 trained doctors in the country who are currently unemployed, and they're questioning the amount of money that is being spent on this particular program at a time when we have about 2,000 trained doctors in the country who are unemployed. And also, let's take a look at the other slide and see some of the reasons that are being given by the KMPDU. Dr. Ouma Oluga in that statement also says that Kenya has 171 unemployed medical specialists, and the Ministry of Health, the county government, hardly promote specialization. They have decried the county government, saying that they are in in no way supporting doctors in advancing themselves, especially in terms of being specialists. So they question the move to bring in 100 doctors when they are putting roadblock after roadblock, which with they, I mean the national government and the county governments putting roadblock after roadblock to see doctors in the country, especially those working in the counties, advance and become specialists in their various fields, be it medical, pharmacy or dental. They also say that Kenyans often speak specialized healthcare abroad, and this only means that the healthcare systems in the country are wanting. So they question, instead of bringing 100 doctors from Cuba, why not advance not just the doctors in the country, but the healthcare system at large in the country? These are some of the questions that the KMPDU is asking. Of course, saying that 2 billion Kenya shillings is being spent in this particular project, yet this 2 billion Kenya shillings would have been used in a number of projects in the country, as well as employing about 2,000 Kenyan doctors in the country. That statement was signed by Dr. Ouma Oluga, who concluded that Kenyan taxpayers' money will go to waste in this particular project, and of course has blamed the board, saying that they have become there is laxity in the board in terms of ensuring the quality in terms of healthcare that Kenyans receive in the country. That was from the statement from the Kenya Medical Pharmacists and Dentists Union, signed by Secretary General Dr. Ouma Oluga. All right, and before we get to more reactions on that particular story, remember our reporter Cecilia Wakesho is also on that. She will be giving us an update. Let's take a quick break. We'll be back with more. Don't go too far.